Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Infant and Newborn Care. Introduction. Going home with a new baby is exciting. However, it can also be scary. Newborns have many needs like frequent feedings and diaper changes. Babies can also have health issues that are different from older children and adults, like diaper rash and cradle cap. This program will help you better understand infant and newborn care. It discusses how to meet your baby's needs and provides information about well baby exams. Holding your newborn. Newborns are fragile and need to be held carefully. Handling a newborn might be scary at first, especially if you are not used to being around infants. This section discusses how to properly hold a newborn. Always wash your hands before you handle your newborn. Young infants do not have strong immune systems. By washing your hands, you prevent germs from making your baby sick. You may also use hand sanitizers. Whenever you hold your newborn, make sure you support his or her head and neck. Newborns cannot lift their heads. Supporting your newborn's head and neck is important in preventing injuries. Never shake your newborn. Shaking a newborn may cause bleeding in the brain or even death. Your newborn is fragile and should not be played with in a rough way. You can also prevent injuries by properly securing your newborn. Make sure you know how to properly secure your infant in a carrier, stroller, and car seat. Diapers. Some parents use cloth diapers. Other parents use disposable diapers. No matter what type of diaper you use, you can expect to change your infant about 10 times a day. Before you change your baby's diaper, you should make sure you have everything you need nearby. This way you will not need to leave your baby alone. You should never leave your baby alone when you change the diaper, especially if you are changing her or him on an elevated table. To change your baby's diaper, you will need a clean diaper, a clean washcloth, diaper wipes or cotton balls, warm water. You may also need fasteners if you use a cloth diaper. Fasteners help hold a cloth diaper together and replace the need for diaper pins, which could poke and hurt your baby. Diaper ointment may be needed if your baby has a rash. If your baby has a dirty diaper, lay your baby on his or her back. You can use a changing table or a blanket on the floor. Remove the dirty diaper. Use the warm water and washcloth or cotton balls to gently clean your baby's genital area. You may also use diaper wipes. Be careful when removing a boy's diaper. Exposure to the air may cause him to urinate. When cleaning a girl, make sure to wipe from the front to back. This prevents urinary tract infections. Apply diaper ointment if needed and put the clean diaper on your baby. Always wash your hands after you change a diaper. Diaper rash is a common problem for babies with sensitive skin. To avoid or heal diaper rash, you should apply diaper ointment. Change your baby's diaper often. Wash cloth diapers with fragrance and dye-free detergents. You may also want to try to let your baby go without a diaper for part of the day. This gives the skin time to dry and heal. Call your baby's healthcare provider if the diaper rash gets worse or doesn't go away after 3 days. Sometimes a rash may require a prescription.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Bathing. During their first year of life, newborns don't need to be bathed every day. In fact, you should only bathe your baby 2 or 3 times a week during the first year. Bathing your baby too often can cause dry, sensitive skin. Make sure you have all essential supplies nearby at bath time. This can include mild baby soap and shampoo, washcloths, and any other necessary supplies. Having bath supplies ready keeps your baby safe. You should never leave your baby alone during bath time. Sponge baths are recommended for newborns until the umbilical cord falls off. This could take 2 to 3 weeks after birth. If you choose, you can begin giving your baby tub baths after it is safe to do so. You can use 1. A new plastic bathtub made specifically for babies. 2. A non-slip plastic bin or inflatable tub inside your bathtub. 3. The kitchen or bathroom sink if you use a towel or rubber mat for lining. Adult bathtubs are not safe for infants due to the risk of drowning. Only fill the tub with 2 to 3 inches of water. Make sure the water is warm and not hot. Keep one hand on your baby at all times and always support his or her head. It only takes a few inches of water for your baby to drown. Usually, all you need to bathe your baby is plain water. If your baby is dirty, you can use mild baby soap. Don't use regular soap. Some babies may develop cradle cap. Cradle cap causes a baby's scalp to develop scaly patches. If this happens, washing your baby's scalp every day may help. Make sure to use a mild shampoo. Have a warm towel to use immediately after your baby's bath. You can prevent rashes by thoroughly drying your baby's skin after each bath. Make sure to dry all of the skin creases. Feeding and burping. Newborns need to be fed every 2 to 3 hours. Healthcare providers usually recommend feeding babies when they seem hungry. Your baby may cry or make sucking noises to show that he or she is hungry. Infants may also put their fingers in their mouth when they want to be fed. If you are breastfeeding, you should give your baby 10 to 15 minutes at each breast. It can be difficult to know if your baby is getting enough to eat when breastfeeding. Your baby is likely getting enough to eat if he or she gains weight, needs a diaper change about 10 times a day, seems full, sleeps well. If you are feeding your baby formula, your baby will probably need 2 to 3 ounces at each feeding time. Most baby bottles have easy-to-read measurements on them, so you can see if your baby is eating enough. Babies often need to be burped during and after feeding time. This is because babies swallow air when they are feeding. To burp your baby, you should gently pat your baby's back while supporting his or her head on your shoulder. You can also sit your baby on your lap and support his or her chin while gently patting the back. Some people prefer to lay their baby face down in their lap. Make sure to keep your baby's head higher than his or her chest if you choose this method of burping. It is also important to keep your baby upright for at least 10 to 15 minutes after each feeding. This prevents your baby from spitting up. Sleeping. Newborns usually sleep around 16 hours or more each day. However, they only sleep for 2 to 4 hours at a time. Newborns are not able to sleep through the night. This is because their digestive systems are small and they need to be fed every few hours. Many infants begin to sleep through the night around 3 months of age. However, as long as your baby is still growing and seems healthy, there is no reason for concern if he or she does not sleep through the night. You can help your baby understand the difference between night and day by limiting nighttime stimulation. Keep the lights low at night. Also, play and talk with your baby during the day instead of during the night. Placing your baby a certain way when he or she sleeps is also important. The following discusses how to keep your baby safe during sleep time. You should always place your baby on his or her back to sleep. This reduces the risk of sudden infant death syndrome, or SIDS. Remove extra bedding, blankets, or stuffed animals from your baby's crib. These items may cause your baby to stop breathing if the item blocks your baby's nose and mouth. Change the position of your baby's head each night. This prevents a flat spot from developing on one side of the head. Well baby exams. Well baby exams usually take place 6 times during a baby's first year. A well baby exam is separate from any other visit for sickness or injury. Babies need to see a healthcare provider 2 to 3 days after coming home from the hospital. After the first visit, they need to see the healthcare provider when they are 1 month old, 2 months old, 4 months old, 6 months old, 9 months old. During a well baby exam, a healthcare provider will ask you questions about your baby and take measurements of your baby. The healthcare provider will also evaluate your baby's development. Immunization shots are given during certain well baby exams. These shots protect your baby from harmful diseases. Well baby exams are necessary even when your baby appears to be healthy and happy. These exams help monitor your baby's growth and development. If you are worried about your baby's health, don't wait until the next scheduled well baby exam. Call your baby's healthcare provider right away.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Going home with a new baby is exciting. However, it can also be scary. Newborns are fragile and need to be held carefully. You should always wash your hands before you hold your newborn. Make sure you support his or her head and neck. Also, properly secure your newborn in his or her carrier, stroller, and car seat. Usually, an infant will need to have his or her diaper changed about 10 times a day. Diaper rash is common, especially if a baby's skin is sensitive. Call your healthcare provider if diaper rash gets worse or doesn't go away after 3 days. Never leave your baby alone when you change the diaper. During his or her first year of life, you should only bathe your baby 2 or 3 times a week. Sponge baths are recommended until the umbilical cord falls off. After this, you can begin tub baths. Never leave your baby alone during bath time. Newborns need to be fed every 2 to 3 hours. Babies often need to be burped during and after feeding time. This is because babies swallow air when they are feeding. Newborns usually sleep around 16 hours or more each day. However, they only sleep for 2 to 4 hours at a time. Always place your baby on his or her back to sleep. This lowers the risk for SIDS. Well baby exams usually take place 6 times during a baby's first year. During a well baby exam, a healthcare provider will evaluate your baby's development. Your baby will go through many changes during the first year of life. You may feel uneasy at first in taking care of your infant. Ask your healthcare provider for help if you need it. Thank you for using Explain.